We're at the Abraham VA Healthcare Center right here in Butler, a brand new facility which replaces, well, in some way replaces the older one over there on Newcastle Road. The director of this facility is Dave Cord, and Dave, you must be pretty proud as to how this place turned out.
Very proud, very excited, most importantly, very happy for our veterans. This has been a long time in the making, years in the planning, and we now have a state-of-the-art facility to take care of our veterans.
It would seem to me it's not easy to get something on the drawing boards with the government. How long ago did you start talking about a new facility in Butler?
So the discussions probably started the better part of a decade ago. So nothing does occur easily, but what's unique about this project is this is a facility that the government did not build and we do not own. This was actually built by a private developer, Cambridge Development, and we have a 20-year lease with them. So this is a new model for the department to try in healthcare, and it creates a lot of flexibilities for us moving forward into the future.
Well, is it your ideas, or is it the VA and Washington's ideas for the actual design of this facility?
It's actually a combination. The idea to try the leasing model is one that occurred at the national level. When it came to the actual construction of the building that we're in now, that was a joint effort between Cambridge Development and their architects and my staff as well too. So we had input from the clinicians who work in this building, and we had input from the veterans that we take care of as well too.
There are 25,000 veterans that are being treated in the VA here in Butler and have been over the years, and probably more in the future. What's the difference? What will they see when they walk in here that's different from the older facility on Newcastle Road?
The big difference that they'll note, and I think what's most helpful to the veterans, all the care that they receive is here on the ground floor of this building. So at our old campus, we had that care spread out over 6 different levels of the building, and it was really not efficient flow, and in many cases it was difficult for our veterans, our patient population. Some have issues with ambulating, and that type of a setup was not as ideal. Here, everything's on one floor. It's really one-stop shopping.
Well, I understand from what you had said earlier that it's even more efficient than that, because the veterans don't have to wander around the building to find different facilities where they need different services. Actually, all these services, all these people come to them.
That's very true. We have a packed pod model here for our primary care, so we integrate services right within primary care that include mental health, social work, pharmacy, and then those ancillary services, the pharmacy, the lab, physical therapy, they're all also on the ground floor of this building. So there is a very logical flow to this design of this building for everything that the veteran needs while they're here.
Why was Abie Abraham the namesake of this building?
For several reasons. First of all, he is a war hero. He was a veteran who participated in the Bataan Death March. Perhaps more importantly for the veterans here at VA Butler Healthcare, Abie volunteered a large portion of his life in service to the veterans we care for. He logged over 40,000 hours of volunteer time in helping us take care of the veterans here at the facility.
What's so interesting was the way he did things, his attitude, because when I came in here to be taken care of as a veteran, he greeted me at the door, and not just me, but everybody else that came in. It made everybody feel comfortable and everybody feel like they're part of an organization.
Oh, absolutely. He was sort of like the mayor of our facility. And when you came into the facility, he made it feel like you were in your home and that you were being taken care of by family and friends. And he set that tone for everybody who walked in the door, including the staff. The staff were all very close to him, felt that connection. He was just part of our family.
Are there some facilities here that were not at the previous facility on Newcastle Road?
All of the outpatient services have moved here, but we have started to enhance some services now as well. For example, cardiology and urology services are ones that we used to send veterans to Pittsburgh for that care. Pittsburgh now sends their providers up here to our new facility, and we're able to treat the veterans with their outpatient appointments right here in Butler instead of making them travel to Pittsburgh.
It's hard to look into the future because there are so many changes taking place, and of course so many new veterans coming in years to come will have different experiences than the veterans this year or last year. How do you prepare for the future to try to make this a facility that will handle whatever the future brings?
Well, that's one of the beauties of being in a system like this or in this setting where we are under a lease arrangement. We have a 20-year lease. We have capability during that time to make manipulation and modifications as we need to the building. But as you just said, I can't stand here today and tell you what healthcare is going to be like, the delivery model 20 years from now. But what I can tell you is I will have the flexibility with regard to this arrangement to make the changes that need to be made at that time to make sure that we have the proper environment to deliver that care.
Dave, how do you, as the director of this facility and also as the major VA representative in this area, know that the care that the veterans are getting is what they should be getting?
The best way I know that is by talking to the veterans themselves. I hold regular town hall meetings with the veterans. I hold open office hours where the veterans can come and talk to me. My phone's always available. I find the best source of information for me about how this facility is performing is for me to get out and talk to the veterans.
Dave, thanks for inviting us in, and good luck. This is a beautiful facility, and from the veterans we've talked to just in the last hour or so, they seem to be delighted with what they have for them now.
Well, thanks. We're very glad to host you and have an opportunity to show off our new facility.
We're in one of the examination rooms, one of the many here at this center, and Dr. Rhonda Mao is the chief of staff. Now, you've been with the VA for many, many years, and you also were in private practice. Is it different working with the VA as compared with private practice?
I find it's very rewarding working with veterans. I have actually always wanted to work with veterans. I had some exposure to the VA back during my training, both in medical school and residency, and it's always a place that I wanted to go career-wise. So I feel very fortunate to have the opportunity to work with veterans every day.
Well, you'd see different kinds of medical problems with veterans, wouldn't you?
Yes, some healthcare problems are more specific and more common in the veteran population. The results of the trauma of combat, amputees, traumatic brain injuries, we tend to see those sorts of problems more commonly than you would in the civilian population.
Well, because of all of that, wouldn't there go along with those physical problems, psychological problems?
Absolutely. Post-traumatic stress disorder, mood disorders, those sorts of problems are very common among our veteran population. And, the impact of those problems on physical health and just overall well-being are profound. And we're always trying to reach out to veterans to encourage them that if they need help, to seek it from us, because that's why we're here.
Now, physically, it looks different from the previous facility over on Newcastle Road, and maybe most hospitals I've ever seen. There's kind of a pod section. There are a whole bunch of clusters of desks and clusters of rooms. Is that referred to as packed the way that we heard earlier?
Yes. So what you're referring to is the organization of our primary care teams, or our patient-aligned care teams. That's the VA's term for the way that we provide primary care services in the VA. And it refers to basically a team of healthcare professionals who all work together and collaborate to try to provide the best outcomes in terms of health for veterans. So those teams incorporate both a primary care provider, administrative support staff, nursing, as well as pharmacists, social workers, and other mental health providers who all work together to help the veteran.
And so in every one of those pods, there's that combination of people, that whole cluster of people?
Well, for the most part, some of the services are shared among different teams, such as the pharmacists and some of the mental health professionals. We do also have a program here that's called Primary Care Mental Health Integration, where we try to focus on the interplay of physical and mental health and try to help veterans to understand that it's important to focus on both aspects and to provide services for mental health care within the setting of a primary care team. It tends to be a comfortable setting for veterans, or at least that's what we're hoping for, that this is sort of like their medical home.
I would guess that many veterans who realize they have a problem that has to be treated feel reluctant to come. They just maybe don't want to hear the truth, or they just don't want to talk to strangers. How do you get over that?
I mean, I think sometimes too, particularly with mental health issues, it's difficult for veterans to talk about their experiences. I think just having a supportive environment, having a good rapport with their providers, and just familiarity will help, hopefully over time, to encourage them to talk about their problems, because it's the first step toward helping them.
Now, you have some enhanced services here, in fact, some new services as well that aren't at the other VA center over on Newcastle Road. Tell us about some of them.
So we have an expanded rehab department here to assist veterans who have physical rehab needs. We also have a therapeutic pool that we're going to be hopefully opening here soon, and that will help with aquatherapy and those sorts of therapies that are helpful for chronic pain management as well.
Is that the one where they can lower somebody in a wheelchair into the water?
Yes, that's it. Absolutely.
And why is that necessary?
It's important, I think, for patients who are unable to maybe get into the pool on their own, and they're able to still benefit from the therapies despite that limitation.
I know one of the areas that's being concentrated on in recent years is suicides and handling those problems with veterans. There's a program in that area here, isn't there?
Yes, suicide prevention is key within the VA. It's something that we are really focusing on in terms of preventing suicides. We do have a suicide prevention coordinator, and we have a pretty robust program here where our coordinator does some staff education, does drills, what to do if a veteran comes in who is suicidal, how to handle it. So we do a lot of work in that regard, and that is a primary focus. And it ties in as well with our pain management programs, because obviously chronic uncontrolled pain, is a risk factor for developing depression and other mental health disorders, and those can obviously potentially lead to suicide, which we want to always prevent.
Doctor, what is it about this brand new facility that you as a staff member like, and that maybe is good for the veterans themselves?
I really appreciate the efficiency of the space. I think having everything in one place is very beneficial for the veterans. I think the co-location of the staff here and the PAC teams is also helpful for them. The idea is that we want the veterans to come here, and then the people that they need to care for them will come to the veteran. We're also working with VA Pittsburgh to try to get more specialists to come here to see Butler veterans, to minimize the number of trips that our veterans have to make to Pittsburgh to receive the care that they need.
Doctor, thanks so much.
Thank you.
Let's find out how this building got to be the way it is, and how it was constructed, and where the ideas came from. Becky Hubscher is the Associate Director of Operations here. And let's start from the very beginning, when it was decided that there was a new facility necessary here in Butler for the VA. How did it start? What's the first thing you had to do?
One of the first things that we had to do was we had to get our staff together, and we had to have the architect come in, as well as having the construction team come in and the design team. And we actually started to talk about, at the very beginning, about what did we envision this building to be? What did we want this building to be to best serve our veterans? What were the services that we were going to offer here? What was the layout that we were going to have here? And as you can see from looking around and from the tour, some of the things that we wanted here was we really wanted all the veteran care to be on the first floor. If you've been to the old facility, you know that you often had to go up and down, and it was very inefficient. So one of the things that we really strived for here was to have the whole veteran experience on the first floor.
What surprises me about what you said is we would think the way the government works, or the way we think the government works, they would have said, okay, you want a new building? Here it is. This is the way it's going to be. But they actually asked you what you wanted.
Yes, and we actually had a hand in how we wanted the building to be designed. Everything from how we wanted the building to be designed to the color scheme of the walls. What color did we want? What kind of murals did we want on the walls? We got to pick the actual pictures that went on the walls. The big, nice veteran murals that you see, we actually laid those out and looked at them. It really was a cooperative effort, but it was an effort that I think really served us all well, as you can see from the building, hopefully.
Having done all that, then it had to be approved by somebody in Washington, D.C., I'm sure, at the VA headquarters. Was it pretty much accepted the way you had planned it?
Yes, it was. We actually had staff that were from central office, from CFM, and they were the resident engineers on the project, and they represent central office, if you will. So they were here, and they were with us and working with us every step of the way on the project.
We've heard so often that when there's a construction project that some shortcuts are taken by the contractor so they can save some money, or some things that were in the plans were not done to save money. How did you know along the way who was the one that made sure that the contractor and the VA knew and understood each other and knew what was going to be going on?
I would say we had a couple people that were key in that. We had a HCC program manager, Sherry Hariliak, and she really was our boots on the ground person. She was here every day. She's been involved in the project every step of the way. So she was the one really providing a lot of the oversight every day and making sure that we were getting everything we were supposed to get, as well as the staff from CFM, the resident engineers were here. Again, that's their job to make sure that we are getting what we paid for, and they did a really good job with doing that.
Now that it's all done and all the facilities are in and the veterans have been coming here and will continue coming here for years to come, are you happy with the way it turned out? Did all the plans on paper turn out to be the way you wanted to in practice?
Yes, I'm very happy. I actually think it's beautiful. I enjoy coming here every day, coming to work. It's nice to walk around and to see the veterans and see them enjoying the space. The space that we're in right now is a children's area. We didn't have this space before at the old facility, especially now we're seeing a lot more veterans who have children, have families. This is a nice place for the children to come. They can watch TV, do some art. We have a lot of extra amenities here that we didn't have before that are also very nice.
When the veteran walks in the door for the first time, there must be some confusion because it's all so new. How does that veteran get to know where to go and how the process works?
There was a lot of confusion for veterans and for staff. That's why we've tried to make sure that every day we have volunteers, and we also have staff that are at the front desk. So as soon as you walk in, if you're unsure where to go, you can just go right to the front desk, which is the first thing that you see, and ask for help. And our staff will, and our veterans will actually, a lot of times, personally take the veterans to their destination.
Thanks so much. Congratulations on the project because it's a beautiful building. And from what we've heard from veterans already being here just this afternoon, they love it. So thanks so much.
Thank you very much.
Of course, the VA has a whole program to treat women's veterans, and Nicole Thompson is the coordinator of that program. How many women veterans are there in this area that come to the Butler VA?
There are just over 1,000 that come here and seek services at the VA.
What kind of problems would they come with? They're not in combat, I don't think, for the most part.
There's a myriad of issues that women face. The majority of the issues they face are military sexual trauma, PTSD related to the military sexual trauma. A lot of women suffer from musculoskeletal disorders because of during their basic training, they have to carry the backpacks, the heavy equipment that's not made for women's frames. And so they have knee issues. So women have a lot of their own special issues with women's health problems. They can come here and seek, get all the care that they need.
Now, the first item you mentioned was sexual trauma. Now, that sounds like the same kind of harassment that happened in civilian life. We hear about it happening in Washington recently. We hear about it happening in corporations, and women have been coming out lately talking about that. So obviously it would happen in an organization as large as the Army or the military. Mm-hmm. So what do you do about it?
So we have special programs here for women. We have a military sexual trauma coordinator who, if a woman is in crisis over a trauma, she can call here, meet with Dr. Flam, and see her personally. And we also have a military sexual trauma group that meets every Friday that gives the women a chance to meet, discuss issues they're facing from their traumas. They don't go into deep discussion about the actual trauma, but it gives them a sense of belonging and a sense of camaraderie.
Well, I'm hoping that you're talking about it here today on our program will reach some people out there who have been reluctant to come out, reluctant to tell their stories out of embarrassment or for other reasons.
Right, right, and that's a big goal of ours. Women veterans are not as likely to identify as a veteran, and so they're not as likely to seek services at the VA, and that's a big hurdle that we're trying to overcome by getting more women to come to the VA. We have about 25,000 women in our catchment area, and like I said, we only service 1,000 of those women, so just trying to get those women to understand that they can come here for all their health care needs is so important.
Well, for something as serious and as sensitive as sexual problems, can they call somebody first? Maybe they want to put their toe in the water before walking in the door.
Right, and they can call. We have if they call the main number to the VA and say, I need to talk to the military sexual trauma coordinator, they can certainly do that. We have that coordinator is available during regular business hours. If she's not here, we do have a backup coordinator. If they're unable to reach them, they can certainly call me, and I can make sure that they're taken care of and have the services that they need.
Is there a special physical area in this facility for women?
Yes, behind me we have our women's health clinic. We have a special room for urogynecology. We're able to do all of our gynecological procedures, urodynamics testing, pelvic floor therapy, and within that packed area we have mental health, we have pharmacy, social work, all of those different areas of expertise to help anybody that might need it.
The first question might be, with some women veterans listening in right now, is whether they are eligible for some of the services here at the VA.
Yes, all they have to do is come into the VA and meet with our eligibility and enrollment specialists to determine whether or not they are eligible. They need to make sure they have their DD-214, and then there is an application form that they can fill out to see whether or not they're eligible for services. If they have suffered military sexual trauma and they want to get care for that particular issue, they qualify for no matter what.
Can they just walk in the door here, or do they have to call to make an appointment?
They can walk in the door. We have open access, so we would, if a veteran was in crisis or a veteran really felt like they needed to talk to somebody, they could certainly come to the VA and be seen the same day.
Thanks very much. Good to talk to you.
Thank you very much.
One of the areas of medicine that's treated here at the VA Healthcare Center is post-traumatic stress disorder. With us is Matthew McCalman. He's a recently discharged veteran, was in Afghanistan and suffered some of those problems. Matthew, tell us about when you first started getting into the combat situation and how that affected you.
We went to Afghanistan in May of 2010. I deployed shortly after that, about 3 weeks later. My battalion was already there. The reason why I deployed late was because my daughter was born May 20th. So I showed up about 3 weeks later, and my unit had already been started in patrols and convoys around the area that we were responsible for. And I was only there about a week, and then that's when I started my patrols and convoys. And on my first mission, as I was saying earlier, it only took about 15 minutes outside the gate and to be awarded my combat action badge. And that was just the beginning.
And that combat action badge is given because you're under fire?
Your actual orders, it states along the lines of either receiving fire from the enemy or returning fire to the enemy. And again, like I said, that was just my very first time off our outpost. And, I lived that almost a daily basis for another 11 and a half months, every day, just about.
So when you got out, they said you now have PTSD, post-traumatic stress disorder. And what did they suggest you could do about it?
Well, the VA is the one that suggested that I talk to one of the psychiatrists here, just because, I knew something was different with myself, and I just talked to the psychiatrist here, uh, who suggested, I put in a claim for it, and it came back, and that it said that I clearly had PTSD from my experiences in Afghanistan. Um, and it was just, to come to the groups they have here. PTSD basic training is one of them. To work with some of the other specialists here on prolonged exposure. It's, you have to speak and talk about things that I've seen and done when I was in Afghanistan. And I'm just beginning that training now, so I don't know exactly everything that it entails. But there's a lot of support here for that, a lot of highly trained professionals that's one-on-one and also group situations and with other veterans.
Now, when you were going through the problems of coming back to civilian life, or maybe even while you were in combat in Afghanistan, what changes took place? What did you notice that was different about yourself and your attitudes?
Well, when we first came back from Afghanistan, our battalion leadership, I was in an infantry battalion, they said, we've asked you to go 100 miles an hour for a year straight, and now we're asking you to slow it down, to 5-10 miles an hour, which is kind of a good analogy because it helped us kind of understand, we've been going in some pretty high stress situations for a long time, and now we're back home, on American soil, and we're not worried about, mortars coming in every day or being fired at, by the enemy. Almost on a daily basis in the fighting season is what they call it. And when I got home, I just realized that, a lot of the things were just loud noises. I was very irritated. I like things to be calm, quiet, probably just because I was in such a stressful situation for so long. I just needed to relax, and it just seemed like, I was just full of anxiety. And like I said, just loud noises, obnoxious people. A big one for veterans is just people who are disrespectful, and I can't quite understand or explain, why I felt these things. Probably just because of the stress.
Do you feel that since you've been here taking the treatment at the VA, that you're feeling better about things, that you're coping with life a little bit better?
Yeah, I would definitely say yes. The VA has definitely given my life back. Again, when I came home, I knew something was different inside me. I came to the VA the day after I was discharged from the military. It took me some time to find out that I was diagnosed with PTSD. And once I did find out I was diagnosed with that, they helped a lot with, getting me the appointments, getting me to the right people to talk about it. They put me into groups, and which helped me understand what PTSD is, why it affects me. Life skills, coping skills that I can use to live with it, even medications. I have nightmares quite often, so they give me medication to help with that, to make them not as intense. I still have them, but they're just not as intense, and just support through other veterans here. It really helps a lot.
Thanks very much. Good luck to you. Sounds like you're on the right track, and I'm sure the VA is helping as you're suggesting, and I wish you luck, and thanks for your service.
You're welcome. Thank you.
So there's just one of the many services here at the VA Healthcare Center in Butler. I'm Larry Berg. We'll see you next time on Faces and Places.